I think what we're seeing with the oral SERDs is there does seem to be this trend that there's minimal to small benefits in patients who have ESR1 wild type disease, but there does seem to be a more significant trend favoring SERDs compared to standard endocrine agents in patients who have ESR1 mutant disease. So we've seen this even in EMERALD, which looked at Elacestrant, where you only saw 1 month PFS delta in the ITT, but you see a 2-month delta in the ESR1 mutants. We also saw this in the ELACESTRANT trial presented at ESMO, where again, no benefit in the ITT, but trend in the ESR1 mutants. And now with EMERA-3 as well, very similar data. And so I think what it suggests is that these drugs do work, but we need to have better patient selection to figure out who those patients are. Certainly ESR1 does seem to be one of those selection factors. But the challenge is that even in an ESR1 mutant population, the PFS, isn't a home run. And what we're seeing is that in patients who've already had a CDK4/6 inhibitor, we actually usually like to use combination therapy. So we don't tend to use a lot of endocrine monotherapy. And we usually like to give an endocrine agent either with Everolimus or alpelisib, depending on PIK3CA mutation status. And so personally, I think one of the ways forward with SERDs will be in a combination where we should be studying these agents with other targeted agents, really, and selecting patients for ESR1 mutations. So, one study that is doing this is the evERA study, which is looking at Giredestrant, combining it with Everolimus and comparing it to an AI Everolimus in a post-CDK4/6 setting, which I think is an exciting trial, which does fit this paradigm of taking advantage of patient selection and using combination therapy. So I think that setting is ideal for SERDs. There are lots of ongoing studies also for SERDs in the adjuvant setting, with the idea being that maybe these agents could help prevent endocrine resistance from developing in patients getting adjuvant endocrine therapy and maybe help prevent a recurrence. I think the challenge is, this is, we don't have very much data to know if this is going to pan out or not. We need to learn and answer this question. And so, again, there are several adjuvant studies that are either ongoing or planned that will help address this.